Hi, this is Elisha Krempitz with Concentra. I'm here with Jackie Bensfeld, our partners at Company Nurse, and we're excited to be here on behalf of Everest. Everest has made a choice to add telemedicine as another access point to healthcare for you. And so what we are going to do today is make sure that you walk away over the next 15 minutes with a very good understanding of how it works. So we'll make sure you're clear on how to set a patient up for a successful visit. What does it look like specifically when you engage Company Nurse for nurse triage and when they identify the patient who is appropriate for telemedicine, and how to add it as another successful access point to care to ultimately impact your claims cost. So we appreciate the partnership with Everest and look forward to walking you through this.
All right, thank you, Alicia. This is Jackie Bensfeld with Company Nurse. I'll first walk you through the benefits of using the Company Nurse Nurse Triage program. When you call Company Nurse first, injured workers get the proper care. You learn about the injury immediately. You get confidence in your providers. You reduce time spent on paperwork and state forms. Litigated claims incidence goes down. Claims volume drops. The cost of claims goes down. You eliminate confusion at the point of injury. Now let's look at the nurse triage referral process. When a workplace injury occurs, the injured employee and/or their supervisor will contact Company Nurse. They'll speak with an injury care coordinator who takes the injury report and offers triage by the RN. The employee will then receive expert medical triage and self-care advice. If the injury is minor, they may only need self-care and can treat the injury themselves. The employer will then receive the injury report. If the injury is more serious and the injured worker needs a medical referral, the RN will refer them to an ER or urgent care, or if appropriate, they'll refer them to Concentra Telemed. The approved medical provider will receive the injury alert, and of course, the employer receives the injury report. As discussed, we make referrals to self-care, occupational health, urgent care, and emergency care, and of course, telemedicine. Let's look at the reporting. Yes. Our reporting eases the pain of workers' comp. Our report of injury includes information about the employer, the injured employee, the injury details, the triage details, and the medical referral information. Pre-populated state forms save you time and hassle. The provider alert is sent to the treatment facility prior to the injured employee's arrival. It includes employee demographic information, employer and workers' compensation carrier data, injury information and triage details, and the work status and treatment plan form. Our incident summary report is a statistical account of the injuries for a specified time period. Now I'll hand it back over to Alicia at Concentra to speak about their Telemed program.
Thanks, Jackie. So as we start off talking about telemedicine, it's really important for you to understand it's very simple. It's just another access point to healthcare. And the way Concentra has approached it, it is reminds me and should remind you of the experience that a patient receives when they walk through our medical center, from walking in, being welcomed, checking the patient in under your employer account, and that way we know exactly who to communicate with, who receives information on the back end, how to communicate effectively with Everest and all parties involved, as well as accessing and engaging with occupational medicine experts from a healthcare standpoint. So everything about a visit looks the same, except for now, rather than having to get in your car and leave and go to a bricks and mortar facility, now that injured worker is able to stay right there in the workplace, and they're able to access the same level of care through their device. It could be a mobile device, it could be a tablet, and it could be a computer. And it follows the exact same process, because everybody you experience behind the screen, they're Concentra providers. So it's available now. By October 1st, we will be in 39 states. The care is 24/7. And so what's nice about that is many times access to care becomes a challenge after 5 p.m. for a work-related injury. So now you're able to get care, get the expertise 24/7 around the clock. Concentra has treated close to 7,000 patients to date as of July of 2019, and all that means is you're not the first. It is a very comfortable process, and so simply all you have to do is make sure that you've set a patient up for a successful visit, because Everest has added it to your program. This talks about the type of injuries that are appropriate for telemedicine. So a couple of things I'll bring up here. When you look at your injury mix, it's not uncommon. Most employers find that about 30% of the injuries that they have to date are appropriate for telemedicine. And when you look at recheck visits, whether they start in telemedicine or they start in a medical center at Concentra, that increases to 60%. But the good news is Concentra and Company Nurse have been in collaboration for the past 2 years, and the medical leadership aligned on what is appropriate for telemedicine. So again, very simple. It takes all the work, guesswork, quite frankly, out of your hands and puts it on the medical experts to determine what's appropriate for telemedicine. And then obviously the patient can be treated. But this gives you a good idea of the type of injuries. The type of injuries that we see most commonly are strains and sprains. And it starts out upper extremity followed by lower extremity, and then back strain are really the most common. Very similar to the injuries that we see in the medical centers. Contusions, abrasions, as well as dermatitis. Dermatitis is a great use case because you can see up close. Repetitive use injuries are very common, as well as bloodborne pathogen. Bloodborne pathogen is a good use case because many times things happen after hours. And again, the only thing that's available is the emergency room. And many times people just need counsel, a conversation, and they can follow up and get the lab work done. But what I'll say about all this is it becomes increasingly important as to why occupational expertise is behind the screen. Because what we found is, again, going back to the sprains and strains, it's important to be able to walk that patient through a very thorough touch exam, getting that feedback, looking at range of motion, comparing right and left, looking at pain levels, looking at function levels, looking at swelling, looking at discoloration. The clinician is highly engaged with the patient to get that really good feedback. So that way we are able to do a thorough exam, evaluation, diagnosis, and treatment, as well as help give the right information so causation can be determined, as well as mechanism of injury. So in addition, that I'll touch on around clinical philosophy, and many of these injuries, they don't need to be taken off work. They are ones that can be returned to work. And so the only other thing I'll say is if the patient needs anything extra, whether it be an x-ray, because we need to rule out a fracture, they need diagnostics, if they need a prescription, all that can be managed and supported. And in our relationship with Everest, we have a good understanding of who are all the partners and where the injured worker or where the patient needs to be guided to get that extra level of care or extra level of support, whatever they need. So let's talk about the patient journey. This is extremely important because this is where you come in and have to make sure that you have a plan, and that plan is thought through, and that plan is communicated in advance of that injured worker engaging with the nurse, and mainly because you want to make sure if company nurse determines that that injured worker is appropriate for telemedicine, then they need to be prepared to know, where can I go for a private encounter? Where is a quiet place? Where is a quiet private place? Most of the time, injured workers will get care through telemedicine, at least the initial injury right there at the workplace, and they will likely do their follow-up visits at home. The other thing that you'll need to plan for is that they know, what tool am I going to use? Am I going to use a smartphone? Most people, in fact, 95% of the patients that Concentra sees to date, the patient is using their own personal smartphone. It works out very well because it's a low barrier to entry. There's not a lot of cost associated. In fact, there's no cost to the employer. And quite frankly, patients prefer it. And it's a very nice way for the clinician to be able to interact with the patient, especially if there's a lower extremity injury, because they're able to walk with the phone. The clinician's able to see the gait, and they can move it around their body part. So those are the two big pieces that you need to plan for. Just like you would send a patient in or an injured worker in to be treated at a medical center, they will need to go with a valid photo ID. And then from an authorization standpoint, the good news is company nurse provides Concentra with the appropriate paperwork that we need, so that way we know that the patient has authorization to be treated. Then the only other things that are going to be important to set a patient up for a successful visit is they need a good working internet connection. There is ability to use data, but will pop up and let the patient know if they want to use data or not. And depending on the plan, some people do and some people do not. That's why a good, healthy Wi-Fi connection is important. And then on top of it, if you use a laptop or a desktop, you definitely want to make sure that the microphone works, as well as, and speakers work quite well as the camera, to have a good video interaction. So those are all very important things to do. We've seen, again, customers go from most patients using their own smartphone to some customers will set up a laptop. Some customers will get a tablet so that patients can use that. And one single device can be used for multiple patients, just like when you log into your bank. The first time you set up a user ID and a password with some additional information, so that way you have your own unique user ID and login. That is the same thing for the patient. And the only time anybody needs to log in is when they are a new patient. We don't need every employee logging in, only when it is a new injured worker accessing telemedicine. And then potentially, if you choose to have a tablet at a single location, multiple people at different times, obviously different appointments, can use that same tablet. And so the last thing I'll say is there is a customer support email. Should you have any questions, you can email telemed@concentra.com if you want to follow up, if you have any questions from the clinician, or if you have anything to share in advance of. So as we look at this sheet, this really is helpful because it walks you through the whole encounter of the patient. And as I shared earlier, what you're going to find is it looks very similar to the flow of the patient when they go into a medical center. So the first thing is they will follow your same process. Don't do anything different. At that point, they call company nurse. And then the nurse will determine, is this appropriate for telemedicine? If it is, then they will warm transfer the patient over, meaning they will have the patient engage with the Concentra Telemed team via the phone. In the meantime, they will also text or email instructions if that patient is not prepared and ready. If for some reason they want to do the visit later when they get home, there's that option as well. So there's a couple of different approaches, whether it be warm transfer the patient over via phone or have the patient log on later. Once they reach Concentra Telemed, we will walk them through the process of downloading the app or getting on the computer to bring up Concentra Telemed via video, because it has to be a video experience. Once they've done that, They will drop the phone connection, and then everything will be an engagement through the video. So from there, it will just be like a FaceTime encounter, like you FaceTime with a family or friend, and they will see the care coordinator first. Again, that's just like walking through the front door and you see a front staff person at any medical office. That care coordinator is going to check in the patient, and thanks to company nurse sending us information over, a lot of the demographic information will be filled out. And then at that point, we will get information from the patient on medical history, family history, the injury history, everything that the clinician needs in the electronic medical record as information to help facilitate a thorough evaluation, diagnosis, and treatment. The care coordinator will pass the injured worker into a virtual waiting room as they send the file and information over to the Concentra clinician. That time in that virtual waiting room will be communicated by the care coordinator to set proper expectation. But to give you a rough idea, it is anywhere, could be from 8 to 10 minutes on average, but appropriate expectation will be set. So once the clinician comes on, they will engage with the patient, and then the patient, at that point, they'll walk them through the exam. Like I talked about earlier, they will walk them through a thorough a touch exam, conversation, and what we have found is that patients are really appreciating and highly engaged. Those clinicians are spending about 20 minutes with them, and so connecting right through a screen, face to face, the doctor with a high level engagement, it's proving to be very successful from a patient feedback score rating. In fact, 84% of the patients that come on have given us feedback, and it's been a 4.7 star out of a 5-star rating to date over the past 2 years. And we think it has much to do with the level of engagement. And then from there, once they're done, the care coordinator will pass, or excuse me, the clinician will pass the injured worker back to the care coordinator. And then from there, the care coordinator will support the patient in any next steps. If for some reason, again, they need an x-ray, if they need a follow-up appointment, or merely do they just need to be checked out. Once they do that, they will then check the patient out, and everybody involved, including yourself, as well as the team at Everest, all parties will receive the appropriate paperwork, the activity status reports, as well as the medical notes to properly manage the claim. So this follows the same process. This is the telerehab. And so in telemedicine, if for some reason an injured worker needs physical therapy, and it's been a very small percent, but if they do have the ability to access telerehab. If they choose and want to do therapy through the telerehab portal, they will go through the same process to the same place. However, at that point, they'll be connected with a therapist rather than a clinician for that level of care, and check in and check out appropriately with the care coordinator. So let's talk about reporting and billing. So the good news is you obviously need to have immediate information so you can support that injured worker to be able to return to work. What do they need? How do they need to be supported? And Concentra will send you that information immediately if it's set up in our system. And that's why it's important to make sure that Concentra has correct contact information, correct emails, so that way we send the email to you to be able to access the portal. So you will receive an activity status report that tells you time in and time out, the clinician treated, a HIPAA compliant diagnosis, as well as what is the modified status, and if there is a follow-up visit, when is it? The next thing I'll talk about is the billing. And so the good news is it's extremely simple. It is the same way the bills are processed in the Concentra bricks and mortar today. And we send the bills over, and there's no additional charge. There is a 95 modifier that calls out that it's a telemedicine visit, but there's nothing extra. It's just, again, one more access point to healthcare through the Concentra system. So let's talk about how you get started. So again, like I talked about earlier, the most important thing that you will want to do is make sure you've thought about what tool is appropriate for us and where can they go for a private encounter. The good news is this is already part of your program. Everest has added it, and company nurse is prepared to support it. So now it becomes you creating a plan, and then most importantly, communicating this out to all the people who support the injured worker. You will want to make sure that that supervisor, that leader, whoever it may be that supports the injured worker in engaging company nurse and calling nurse triage, they know that should company nurse let the injured worker know that telemedicine is the right level of care, they have let the injured worker know that this is where you can go for a private encounter. Should the nurse make that recommendation for that type of care, here is the tool you can use. If you do those things, you will set this up for a very successful visit for your injured worker, number one. Number two, you should have a very, very happy employee. Again, I'll say that the patient experience scores have been highly positive. And I'm very confident that if you have an injured worker who gets care, it becomes very easy to get the care. It becomes very seamless. There's expertise behind the screen that knows how to manage the claim and support the claim. Then that's just a recipe for a very highly engaged person in their care, and that's what drives a good outcome. So the good news is in addition to this video, Everest has supplied you with all the tools and resources by Concentra. There's a Concentra Telemed demo video. That's a 3-minute video, and you will see that in coordination with it. It's 3-minute and 22-second long to be specific. That will walk you through the entire process. Then you will have the starter kit. Everything I've shared with you today is written out in that starter kit, as well as you'll receive the FAQs, if should you have any questions that are most common and frequent, and then a step-by-step instruction for the injured worker so they know themselves, how do I log on? In addition to company nurse sharing it, it's nice to have that available. We see customers make copies. We see customers who will laminate it and post it on a wall next to maybe a map of the designated medical facility. So now your employees know that you've got this additional access point to care. And at the end of the day, what this should do is, again, it's no silver bullet, but it should absolutely be a great opportunity and a great way to increase productivity and decrease claims cost through effective engagement of accessing expertise in occupational health care.